Hey, what's up guys, this is Dr. Leo with Everyone Athlete, and today we're going to be talking about why your ankle mobility isn't fixing your squat. Why is it that when you guys do all these calf stretches, all these drills, all these mobilizations that you see on YouTube and that they're promising will help with the squat isn't helping at all? Why is it that you guys still feel unstable? You feel like you're going to fall backwards or forwards and you're not able to squat all the way down feeling steady and confident? Well, yes, ankle mobility does play a role in your ability to squat all the way down comfortably, especially without falling backwards. It is only one piece of the puzzle. And honestly, all my clients and my patients who come into the clinic, or I should say the majority of my clients who come into my clinic, a lot of their issue is not at the ankle. It's actually in another part of their body. An easy test that you guys can do to make sure that this ankle mobility is actually not the factor that's limiting your squat. What I want you guys to do is go up to a wall and place your feet approximately 4 inches away from the wall. Keeping your heel on the ground and in contact at all times, I want you to bend your knee forward like you are going to try to touch your knee to the wall. If you are able to touch your knee to the wall without lifting your heel up off the ground with your toe 4 inches away from the wall, you should have plenty of ankle mobility to be able to squat all the way down. The joint that's often the trickiest to treat and is often the culprit in this squatting pattern is at the hip. We don't notice it most days because all we have to do is squat to about 90 degrees. If we're getting up and down from a couch or from a chair, we don't ever have to go past that point. And so that's why it often goes undetected until we go to the gym and we try to do a deep squat. So in today's video, I'm going to give you guys a couple of the best exercises that I give to my clients and my patients in order to free up that hip so you guys are actually able to squat all the way down, pain-free, and with ease. So the first exercise that we're going to do is going to be for hip mobilization. We always want to mobilize and gain more motion before we stabilize and strengthen into that newfound motion. So the first exercise we're going to be doing is shin boxes, or I've heard this also being called hip boxes. Okay, so what you want to do here is you want to sit on the ground. You want to position your feet kind of so that they are both at around a 90-degree angle. So I started off this a little bit weird, so you actually want to start right here. 90-degree angle, and all you want to do here is you want to keep those heels on the ground, come up, and drop down the other way. Okay? So I'm doing it without hands, but obviously you guys can use your hands here if you need it. The further you lean back, the easier it will be. And as you guys feel comfortable, you can lean forward and do them just like this. This is going to be working on the internal rotation and external rotation of your hips. And these are a great drill to be able to help unlock your hips so that you can get them out of the way and move them appropriately when performing exercises such as squats. So the next exercise that we're going to do is now we're going to strengthen into that new rotational motion that we've just gained by performing these shin boxes or the hip boxes. So what we want to do here, this is pretty simple. You're going to find yourself a chair, anywhere that you can sit on. A stool can work as well. But all you're going to do here is you are going to pull that foot up as much as you can, then push it out as much as you can. A common issue that I see when people are doing this in the clinic is that they either try to lift their legs up so it looks like they're picking their foot up a lot higher, same thing with the out, or sometimes moving their whole body. But again, we want to isolate the rotation at the hip. And so all I want you guys to do here is to, again, act like there is a rod being stuck right through your knee, straight out through the back of your pelvis, and just try to pick up, hold it for a few seconds, come back to neutral, and really push. When you're going to the inside, you should feel it out on the lateral part of the hip, and when you're going towards the outside, you should feel that towards the inside of the hip. So this is a perfect, easy exercise that you guys can do anywhere to strengthen into that new rotational motion that we gained. So the next exercise that we're going to be doing is called banded hip mobilizations. What you'll need for this one is a super band like this one. the tighter or the more resistance that you can find with a band like this, the better this will be. You can also perform this with a strap or a belt or anything like this as well. So I'm here at home. I mean, I have a table. This is proof that you guys can do this really anywhere. But if you're in a gym, you could also wrap this around a pole or anything like that. Gyms should have these super bands as well. Okay, so what you want to do is wrap the band around the pole at about the same height as where your hip would be if you're kneeling in a position like this. So what you want to do here is loop this around your hip, and you're going to want to get enough tension on that band so that it's pulling your hip slightly off to the side. So what you guys got to do here is get this band as close to your crotch as possible. That way we're getting the most effective and the closest pull on the hip joint itself. So once we have a good amount of tension and you can feel a little bit of stretch on the outside, what I want you guys to do here is relax the musculature or the glutes of the hip and gently press in the knee, feeling that stretch on the outside of the hip. Now, when you guys come out of this, I want you to have your hand resist, and you should be pushing hard up against that hand so that now the muscles are working hard again. Remember, we want to mobilize, then subsequently stabilize. And so the first part of this is the mobilization. We are gently relaxing, pushing that hip in. You can even add in some bending like this to the front. Feel that stretch. And then subsequently push back off to the side. So again, what we're doing here is we are trying to mobilize or gap that hip joint just a little bit and hopefully decrease some of the stiffness of the ligaments and the surrounding structures deep around that hip joint. The last exercise we're going to be doing in this list is going to target the glute medius muscle. Now this muscle is responsible for keeping your knees and your legs out as you squat down. And so weakness in this muscle is going to cause a bowing in of the knee, especially as you come down, which can be a very big limiting factor in how deep you guys can squat. You guys will need just a band, just like this, a small looped band. I will have links in the video description for all the bands used in this video in case you guys want that. So what you're gonna do here is you are gonna put this around both of your knees right above the joint line. And what you're gonna do here is you are gonna get on one leg and press straight off to the side, just like this. You might feel this in the side that you're actually moving, or you might feel this in the opposite side. I'll give you guys a side view here, coming straight off to the side. Again, a compensation I see is people coming either out in front or out behind. But what I want you guys to do is focus on coming straight off to the side so that you are getting the most appropriate contraction of that muscle. So there you guys have it. Some really good exercises to address the mobility deficits in your hip and finally unlock that depth that you guys have been looking for in your squats. If you guys like this video and you like this type of content, like this video, subscribe to this channel, and ring that notification bell so you guys get notified every time a video comes out. Thank you guys so much for watching, and as always, I'll see you in the next one.